Are you concerned about agitation associated with Alzheimer's dementia in a loved one? You may want to consider a clinical study called ASPECT. Agitation is a common and serious problem among people living with Alzheimer's dementia and can be very disturbing for patients and their loved ones. You may notice one or several of these behaviors in your loved one: pacing or aimless wandering, screaming and shouting, destroying property, pushing people, kicking, or throwing things. If this sounds like someone you love and their agitation is becoming overwhelming, you may consider having them participate in a clinical study. Pharmaceutical companies use clinical research studies to learn more about investigational drugs before they're made available to the public. To be eligible for this study, a potential participant must be between the ages of 50 and 90, have a diagnosis of probable Alzheimer's dementia, have moderate to severe agitation that interferes with their daily life. First, let's talk about why the ASPECT study is important. There's a significant unmet need for a safe and effective treatment for agitation in patients with Alzheimer's dementia. This study is testing an investigational drug for these patients. In the ASPECT study, researchers want to find out if AVP-786 is safe and effective or useful to manage agitation in adults with Alzheimer's dementia. This study will compare AVP-786 to placebo. Individuals who participate in the study will be asked to take the study drug. The term study drug refers to either AVP-786 or placebo. Participation in this study is voluntary, and those who decide to take part can choose to leave the study at any time for any reason. The study drug is provided in a blister pack as capsules to be taken by mouth. As the participant's caregiver, you'll be instructed to give the study drug to the participant twice a day with water. They will take one capsule in the morning and one capsule in the evening. At some visits, the participant will take their morning dose of study drug in the clinic, regardless of the time of day when they have their appointment. Study staff will let you know when to plan for this. You and the participant will be asked to attend 10 study visits throughout a screening period, treatment period, and a follow-up visit over a period of 20 weeks. Each study visit will last about 2 to 3 hours. As a caregiver, your role in this study is very important. You'll be asked to spend at least 2 hours a day, 4 days per week with the study participant, personally accompany the participant to all study visits, and tell the study staff about the participant's behavior, mental state, memory, and ability to think and perform day-to-day tasks. You'll need to keep daily diaries to record that the participant takes the study drug correctly and log their behaviors. You will bring completed diaries and all used and unused study drug blister cards to all clinic visits. You will also complete questionnaires about the participant's quality of life and your role as a caregiver, and let the study staff know if you or your loved one wants to stop being in the study for any reason. During this study, you'll also need to report changes in the participant to the study staff, including changes in medications, unexpected or unusual symptoms, behavior or physical changes, health changes such as sickness or health problems. Lab tests, a physical exam, and other assessments and questionnaires will be conducted at the study visits. Not all activities will occur at every visit. By agreeing to take part in this study as a caregiver, you are agreeing to personally be involved for the duration of the participant's time in the study. Someone else cannot take your place, because as the designated caregiver, you'll be asked questions about the participant's health and side effects. You'll also be asked to assist in determining what changes in agitation have occurred. If you become unable to personally do what is required, please tell the study doctor immediately. Participants in this study will have their health monitored frequently. However, services and evaluations carried out as part of the study should not be a substitute for ongoing medical care by a primary doctor. The study drug may help to manage a participant's agitation. However, there is no guarantee of this. There's also no guarantee that a participant will receive the investigational drug rather than a placebo during this study. You should know there are possible risks involved with any clinical research. The study doctor will review the risks with you. In particular, participants may be prone to falling while taking AVP-786, so extra care should be taken when standing up or getting out of bed. You may be wondering about costs for the ASPECT study. Participants and their caregivers do not have to pay for the study drug, study supplies, study visits, or tests that are part of this clinical study. Visit www.aspecttrial.com for more information. Thank you for your interest in the ASPECT study. With study volunteers, we can continue this important research on agitation associated with Alzheimer's dementia.